Before we dive into knee replacement details, it's beneficial to understand the structure of a healthy knee, how it can be damaged, and what exactly knee replacement surgery does to improve that particular situation. The knee joint is where two bones come together and form motion. The motion is the junction between the terminal end of your thigh bone or femur and the upper surface of your shin bone, known as the tibia. Then there's the kneecap that sits in front of the knee and actually protects the joint, and is the area where the muscle or the thigh muscle pulls the leg or lower leg bone up into extension. The areas where these three bones touch are covered with cartilage. This articular cartilage is smooth and slippery and covers the terminal ends that make up the knee joint itself. Normal cartilage acts as a near frictionless surface, allowing the joint to glide one bone over the other. The cartilage also acts as a shock absorber, protecting that underlying bone. The knee is surrounded by a capsule, and within this capsule, there's a layer of tissue that generates a small amount of fluid to lubricate the joint and supply nutrition to the cartilage. In a smooth, healthy joint, there is painless motion as you function with the joint. As most people's age, though, what happens is there's wearing away of the cartilage. This process can be accelerated by inflammatory disease, a malalignment of the limb, or mechanical overload such as obesity or trauma, just to name a few of those factors. The most common type of arthritis is osteoarthritis, or degenerative joint disease, which can be thought of or analogous to a tire's wearing out the surface of the tire. So in your car, when your tire wears out. This arthritic process or the joint gradually becomes painful, can limit function, quality of life, and activities of daily living, leading to muscle weakness and reduced function. When more conservative treatments fail to relieve the symptoms, knee replacement surgery becomes an option to improve pain, mobility, and function. During knee replacement surgery, while you're asleep, usually under spinal anesthetic, the damaged bone and cartilage are resected and replaced with implants, also called prostheses or total knee arthroplasty. During the procedure, metal and plastic components are used to resurface the ends of the bone that form the new joint, along with the plastic button to resurface the backside of the kneecap. These artificial implants help to improve the alignment, motion, and function of the knee. Upon completion of your operation, you will be moved to the recovery room. There you will be seen by members of our care team who will make sure that you're stable and comfortable. You will be up and out of bed with the therapist, both physical and occupational teams, the day of the surgery. You're encouraged to put full weight bearing on your new joint. Early ambulation the day of surgery is critical and extremely valuable to your recovery. You will initially be instructed by therapists on how to walk safely with an assistive device. If you progress well, meaning mobilizing with the therapy the day of surgery, and you meet certain milestones, you'll be able to go home the same day as your surgery. Otherwise, you'll stay overnight and repeat therapy sessions the next morning until you demonstrate safe ambulation with a walking aid. Once this is achieved, you'll be able to be discharged to home. When the time comes to go home, your care team will review written instructions with you, including what to expect, how to manage the swelling, discomfort, and the medications. Once discharged, you can follow the online therapy platform called Force Therapeutics, which can assist you in your recovery. Depending on your preference, in addition to self-performed exercises, a home therapy program or outpatient program can be arranged for you as well. On average, it takes about 6 weeks to resume normal activities of daily life, and although every patient progresses at a different speed, your comfort level will improve. During that time, patients transition from a walker to a cane, and then when safe and confident, no assistive device at all. You'll gradually return to your normal activities and routine, making sure not to rush after your knee replacement surgery. Most patients have significant decrease in their pain and substantial improvement in their function. Your new knee joint is expected to last decades, depending on your activity level. It's important to follow your care team's instructions closely, both before and after surgery, to reduce your risk of complications. Joint replacement surgery is a major operation and requires a great deal of time and hard work on the part of the patient. Your effort, dedication, and patience are valuable for successful surgery and recovery. Good health and best wishes with your new knee.